let's go back because this is a relatively new facility. Before we start talking about what y'all are dealing with right now, there were some gaps, if you will, in Barnwell, Bamberg that y'all filled with the Regional Medical Center that just opened not too long ago, right?
Yeah, so a couple of things. The main medical center is here in Orangeburg, and this part is not new. It's actually been there since 1981. But in the Bamberg Barnwell area, you're absolutely correct. We built that facility, had the ribbon cutting April 1st of 2019, and we opened for business in April 8th of 2019.
Wow, so y'all are coming up on that 1-year anniversary.
Absolutely, and we are enjoying the opportunity to serve the good residents of Bamberg and Barnwell.
And Carol was telling me that you guys had projections for how you thought it would do, and it's just blown it out of the water, showing how great the need was.
Absolutely. We're seeing, 60 people a day or more at times. And I mean, the community is so thankful. And you know what we're really happy about? It's not just a healthcare opportunity. It's also been a little bit of an economic engine because some of the employees in that facility live in the counties. So it provides some security and some economic stimulus as well.
That's awesome. And so let's fast forward to now, almost a year later, you guys are hit with, I mean, arguably the toughest healthcare challenge our country has ever seen. You guys took some steps pretty early in general for the state of Georgia, or the state of South Carolina, excuse me, but definitely steps ahead of most rural places. Why'd y'all do that, and what did you do?
Well, first and foremost, here at Regional Medical Center, we consider the opportunity to serve. It is an honor and a privilege for us to serve our community. And we have some wonderful and amazing staff here. One of our physicians, our nurses, our lab techs, our environmental services workers. It's all about community. And our chief of the medical staff, which is Dr. John Sammies, recognized, and we were talking to him, he's like, we need to start early. So between him and Mickey Wisenhan, who is my senior director for quality, we started meeting 5 weeks ago. And we started working on our emergency management to say, where are we with PPE? Where are we on surge, negative rooms, ensuring that we could do all we needed to do proactively for our people that we serve here.
And one of the things that you guys did way back when was limit visitors. And I understand it, people in the community, not so happy about that at the time, but now hospitals across the country are doing what you guys did weeks ago. Why did you guys make that difficult step that you knew people weren't going to like? What made you make it so early?
Well, once again, and I'll use the example of being a parent. There are things we do for our children that they don't like, but we do it because we love them. And here at the Regional Medical Center, we love our community. And when we sat down with our physicians and our nurses and other clinicians, we said, when you think about this disease being droplet, airborne, combination of it's all about exposure. And how can we minimize the risk? Because in healthcare, one of the things I've always been taught is first do no harm. And why would we want someone to come if they have the potential to be exposed to harm?
Yeah. And so what have you guys been seeing more recently in terms of numbers, testing, et cetera?
Absolutely. So today, when I look at our test, we have tested hundreds of people. I was looking at the numbers earlier. Over 180 people have been tested. When you look at our satellite sites of primary care clinics and at our hospital. In addition to that, we've had, over 10 positives. We have some that are here in the hospital, some that are in the community. Now, like most communities in most states, the state of South Carolina, we're holding on a lot of tests. You will see our wonderful governor who will be speaking later and talking about how we probably have over 1,000, you will hear it, over 1,000 tests that are pending. That's not because people aren't working hard. It's because of the surge. Tests are coming from all over the country, all over the state, and it takes time to process them and process them correctly. You're seeing a lot of people are starting to become very nervous, but what we want to do is ensure people don't panic. Listen to the healthcare providers. Listen to the conversations around social distancing and follow through. One of the things we shared at the press conference is if you go to the doctor and the doctor says do X, Y, and Z, let's do that. Let's social distance. We understand that at times you might want to leave the house, but still use common sense about it. So just keeping people calm, letting them know we're here. If they're feeling any symptoms and symptoms that may come on, call your primary care physician and they will be guided from there.
Do you feel like, and it's okay if the answer is no, that there are any unique challenges specifically to Barnwell Bamberg that are different from the state of South Carolina as a whole, or do you feel like the challenges are pretty congruent throughout?
No, I do believe they're different, and I'll tell you why. When you look at the rural landscape of this country, so much, now let me pick South Carolina. South Carolina is made up of 46 states, 46 counties.
Yeah.
6 of them are urban, 40 of them are rural. When you look across the rural landscape of this country, many of your rural parts don't have broadband. So many people are getting their information how? They do what? They Google it. If you don't have broadband and internet service, you're not Googling anything because you can't get online.
Right.
Another thing that people in the rural market struggle with is transportation. So if you don't have transportation, how do you get to where you need to get the services you need? I'll share a statistic with you, and I think this is important. When you look across South Carolina, primary care, you remember earlier we said if you're feeling the symptoms, go to your primary care provider. Well, across the state of South Carolina, we have between 10 and 11.5 primary care physicians for every 10,000 residents. However, that's not equal across the state. Pick, for example, great cities like Charleston. There may be about 22 point some change for every 10,000 residents. In a place like Greenville, they have 15 point something for 10,000. Orangeburg, we only have about 8.3, 8.4 primary care for every 10,000 residents. Bamberg, it's around 2.5 to 2.7. So if I only have 2.5 to 2.7 or so doctors for every 10,000 residents, do they really have access to care? Meaning, do they have access to someone to call if they're feeling symptoms?
That definitely puts it into perspective and the challenges that they're facing in Barnwell and Bamberg. I understand too, in terms of you guys have stopped doing elective surgeries, correct?
Yes.
When did y'all stop doing those?
Well, we stopped doing those. We started having the discussions early on about, limiting access to the building. So we started early on over last week, but really going in and saying was this week where we said, okay, all of your elective procedures must be reviewed. And the way we did it here at Regional Medical Center is we utilized an established committee of our medical staff, the quality committee, because I think it's important to say we need to not always use the word elective. I know it's kind of a common term, but what we like to look at is urgent or emergent cases, because we want to ensure those things that have run the risk of further damaging or hurting or harming, those things are done. So what our doctors do, and they have been amazing in this effort, they submit all of their cases by 11 o'clock. And that quality committee, which is made up of physicians, our chief of nursing, our head of quality, and myself, we review those cases. And literally, I'm there from an administrative standpoint. I am not a doctor. Those great physicians do the work and the heavy lifting, and I thank them for it. But by 1 o'clock, they know if that case can go forward. Now, in doing that, and it may be your next question, that poses a major problem, not just for our hospital, but every hospital across this country.
Right.
You've heard people talk about revenue. How do we keep business going? Well, when you close and shut down elective procedures, you now impact the revenue of your healthcare industry and hospitals. But unlike the other industries, ma'am, our expenses are going up doing this. So the question is how do you salvage your healthcare system in a very tough and unprecedented pandemic that is killing my revenues while increasing my cost? It's not a sustainable process.
And this is a loaded question, but what is the answer? How do you keep a hospital viable given the conditions it's in?
Well, we're going to need help from the government, but I don't want to stop there. It needs to be looked at in two buckets, not just hospitals, but rural hospitals. And if you Google this, you'll see this. Over 120 rural hospitals have closed over the last 10 years in this nation. Now, there's studies out there that say there's another 453 hospitals that are at risk. So you take a hospital like RMC, we are serving 4 counties, basically. We're owned by 2, but we service 4 counties. That's 2,400 square miles. We don't have the reserves of a large hospital chain. So every dollar is important. So I really believe our government should do is say, okay, there's the bailout, whatever term you want to use, or stimulus cash for hospitals, but we need a separate bucket for those rural hospitals to ensure that they can maintain operations and just make payroll. That's not to scare anyone, but we don't want to wait to get there to say, can we make payroll? Can we keep the lights on? Can we provide those basic services?
And when I messed up before and said Georgia instead of South Carolina, it's because we are a 2-state coverage area. We cover Georgia and South Carolina being in Augusta. And you mentioned rural hospitals closing. Jenkins County was not too long ago, right on the cusp of that, with Optimum saying we're out. And then as I was Googling, looking for all of our rural healthcare providers, Hancock County, not just but 2 years ago, it's still on Google. You can still pull up the hospital, but it says permanently closed. And so those are two very close to home examples. One almost closed down and thankfully it was saved. One did end up closing down, leaving the people in that county without a hospital, period.
Absolutely. And it's really sad because we're all, when I look at the Americans in this world who have worked their entire lives, they paid into our system. I was down in Barnwell County who lost their hospital in 2016.
Yep.
And when I was sitting in that county council meeting, I saw this woman, and she was, I guess, 75, 80 years old on her cane. And she walked up to the front and she said, "What are we going to do about healthcare?" She said, "I have to drive over an hour to see a physician." Now, when I look at that great American, that woman who's been here, she's pledged allegiance to the amazing flag we all love, and she can't get healthcare without driving an hour. Is that really what we think of our people? I think not. We have to find a way to ensure that no matter where you sleep at night, wherever your residence may be, you have access to health. I mean, you think about it. In order to have a more perfect union, we talk about health and welfare. We must ensure that for all Americans, regardless of what their geographical address is.
Why do you think, even from y'all's projections, you knew when you put that medical center in Barnwell, Bamberg area that it was going to have amazing numbers because of the lack of care until it opened? But Carol was saying those numbers have even surpassed what y'all expected. Why do you think that is?
Well, people have a need. Not just those who are older and sick, but just think about, the mother whose child's outside playing and they hurt themselves. Kids fall and say they break an arm. Well, do you really want to drive an hour while little Johnny's arm he's holding it, trying to keep it, still before he busts a blood vessel or something? Now they have it right down the street. They can access it. And what I believe was happening is they had a need, but because it was so far, they went without until it was now a catastrophe and people were filling the EDs up. Now we've provided an emergency department, an outpatient diagnostic center with lab and radiology. And hopefully soon, as we talk to our board, which I am so thankful our board has allowed us to move forward, we may be looking at some other services there for the people out there.
Awesome. Well, you mentioned lab, and I talked to, again, mentioning Jenkins County in Georgia, I talked to their CEO today, and they've been having some trouble with their turnaround time. They've been having to wait 7 or 8 days for their turnaround. Now, they're in a little bit of a different boat. They've only tested 2 people compared to what y'all have tested. How has that process been going, where you get the swab in your medical center and then you send it off to get testing? What's the turnaround result for y'all?
And it varies. So when we do a lot through DHEC, and we also do some private labs. You have some that are coming back in 48 or 72, but they're absolutely right. We have some that are taking 5 and 6 days. And once again, I don't believe that's because people aren't working hard. It's because there's so many tests coming in, but 5 or 6 days, the question you have to ask is, if you have a patient who's non-compliant, who are they coming in contact with in that process? And this is another thing to think about. Say they are an inpatient. These are patients that you have and you're holding and you're caring for, and you don't know what's going on. So you're burning PPE. There's cost. And I want to point out to you, that is major. In the first week alone, we went through over $100,000 in supplies and cost. Yes, that is a significant cost. Like I said, revenue's down, expenses are up. labor and other things, but just in supplies and other things, over $100,000 in the first week.
And so if somebody, their test were to come back negative, maybe you didn't need to use all those masks in the room with that person. Wow. So how are y'all's PPE stocks doing right now? Are you guys good? Needing more? What's that like?
We definitely need more. And, one of the things we've tried to share with our community in our press conference on our website, and I would please say, if anyone goes to our website, we have a teal band at the top. You click on that. We need donations. And we need donations from a standpoint of financial, because we're also going to be trying to provide daycare, day camps for our essential employees, because as you know, schools and many daycares have closed.
Yep.
At the same time, we need to buy PPE. You've heard the stories about gouging. And I want to be careful with the term gouging. We understand we are in a free market system where supply and demand reign. I appreciate that as a person who loves business. But when we are paying 5 to sometimes 7 times the average cost on a piece of equipment, it's, once again, I'm going to say, not a sustainable process.
Yeah, totally. And you touched on this, and I understand that Monday you guys have something pretty spectacular happening. You called Governor McMaster and said, look, I know you guys shut down this YMCA, but we got to get it back open again. Talk about that.
Well, we work with the state, and we didn't call Governor McMaster personally. I mean, I would never be disrespectful, but the
his office. Let's say this, his office. Yeah.
Well, I'll tell you, and I want to give credit where credit is due. The South Carolina Hospital Association, led by Thornton Kirby, they have been amazing to us in helping all of the hospitals. But they work with the state with us, and we reached out to the YMCA, and come Monday, they're going to be opening. So children from 0 to 14 for our essential staff, they will provide daycare at a daily rate. The hospital will then be supplementing with food and supplies. And, we're going to look at our budget to see if we can also help some way financially. We haven't made that decision yet because it depends on how many children are going. But one of the things I have to ask myself, my staff, how many of them can afford a daily rate of $35 or $45 a day? If you got one kid, that's not easy. But if you have two, it's even harder. So we are looking at our financials, even with our increased costs, to say, what can we do? So when we talk about donations, not just PPE, but also day camp and daycare assistance as well.
What was the catalyst behind that? Were your staff just really hurting once daycares closed? I mean, that's tough if you've got, even if you have, I almost said single parents, but even two parents, if you both have a job and you got to go to that job and your kids are not in school, what was the conversation like? Were you just hearing a lot of, the essential staff needing that?
Well, we heard it, but before hearing it, I mean, I'm a parent. I have 2 children. Fortunately, my children are teenagers, but I haven't forgotten those concerns around April or May every year when it's like, okay, what do I do with my babies in the summer? So when you shut school down, it's not just the daycares. You got to think about the 8-year-old who's in the 2nd grade. That's not really the child you want to leave at home all day while you work a 10-hour shift.
And a stressful shift at that.
A stressful shift, exactly. So we started listening to our staff. And at one point, our number in this small hospital here was 92 children that we needed to find daycare for. That's a lot of kids. So one of the things we've worked with we know that all of them won't be at the same time. One of the questions we've gotten as we work with the Y is, okay, we want to maintain social distancing. We want to have a ratio of provider to child that will be workable. But what I love about this partnership is they are a nationally known, reputable company with trained staff, with background checks already done, so they can be in a safe environment.
Right. And one that coming up pretty soon would have summer camp.
Absolutely.
Yeah, so they're probably prepared for a bunch of kids.
Exactly.
And so I just want to make sure I'm right. That starts Monday, correct?
Yes, ma'am.
Okay, awesome. I'm trying to think, any messaging you need us to get out to the people in Barnwell, Bamberg? Maybe people are still continuing to just show up to the ED and you need us to, reiterate, drive home the point, you got to call first. Anything that you guys are noticing that are challenges that we can help in disseminating that message?
If you feel like you might have issues, call your primary care physician, call DHEC, call us. Don't just show up, unless it's an emergency. We want to take care of you. don't panic, maintain social distancing. For most patients, young or whatever, if you're feeling, it will hopefully pass. But please, please, please call us. Don't just show up. Try to stay away from, large crowds. We understand people have to go to the grocery store. We understand individuals may need to go to the laundromat. But when you go, get back home. And we are here for you. We care for you. We truly do love our community, and we're doing all that we can to communicate daily what's going on and being as honest and transparent as we can.
Those PPE equipment that you guys are needing, we've seen a lot of people like sewing masks and doing stuff by hand. Is that something you guys need, or do you need PPE in other areas?
If you know of anyone out there that have masks, gowns, they have an idea to sew things, contact us. Reach out to us. Our head of our procurement department, Mr. Gordon Edwards, is doing a great job. Reach out to us on our website. We will get you to the appropriate person. Innovation, this is when innovation is born. When you have these type of catastrophic incidents all over the world, people start thinking outside the box. There is no bad idea. There is no bad lead. We'll take all leads, all suggestions, and we'll work them and conversate with you.
I think this is my second to last question. And it is telemedicine. We've kind of been almost forced to use it. I know that hospitals, specifically rural hospitals, have been looking for more avenues to telemedicine well before this, but this has almost been kind of a crash course in telemedicine for many communities. Do you feel that there's a silver lining in the sense that this crash course has forced us to use this technology, and then once we do get through this, hopefully soon, people, the government, insurance companies will be much more apt to latch on to telemedicine in order to help rural communities? Do you think that will be kind of a silver lining? Like you said, innovate will come out stronger?
Yeah, and I think there's two buckets you have to consider when you're talking about telemedicine. When we first started talking about it, the push was to pay for telemedicine. So that's for your systems that already had a system in place that they can now say, oh, we've been doing it, but I can get paid for it. When you have your smaller systems like us, we're not there yet. We've come online with tele ICU. We've come online. We work with some of the larger institutions on telestroke. So we are in the process of developing our telehealth because we do have primary health clinics in 3 other counties. And my CIO, Ms. Michelle Edwards, and my Chief Operating Officer, Ms. Nicole Hendricks, they're working together with their teams out there. And our physicians, I think, are going to be very, very happy because we're trying to solidify a platform where we can roll out telehealth possibly as soon as next week so that our patients can feel comfortable. But the question will be, if the patient is in an area that doesn't have broadband, how will we do it? But we're not going in a negative way. We're going in a positive way, but we have to be mindful that that could be a case and know how to do it.
For sure. Well, to your credit, sir, anyone who I've talked about you before virtually meeting you has just stressed how passionate you are, how much you care about your community, and they can feel that now more than ever. And coming from a CEO, these are the times where you need that kind of leadership, now more than ever. What do you think it is that makes you so passionate about your job and the people that you serve?
Service is the rent that I pay for the grace that God gives me every day on this earth. So that's why I do what I do. I can't tell anyone else what to believe, but every day that I'm allowed to wake up and I'm allowed to serve, I'm happy with it.